Hi everyone, and welcome to this week's session of The Way to Wellness. Today we're talking about the 4 phases of whiplash injury, and I have 2 vehicles here, and don't worry, I'm not going to have a Tommy Boy reenactment, but I'm using the vehicles just to demonstrate that when you have 2 vehicles come together and the force moves into another one, a lot of people think, well, hey, my vehicle isn't totaled and I can walk away from the accident, so I'm just fine. And that's not really the case at all. People don't realize that the vehicles themselves may achieve an acceleration of about a 2G force, but in a 20-mile-an-hour accident, studies have shown that the head can achieve an upwards of 12 Gs, which is about the fast as someone in a rocket will achieve. But in 12 Gs, that doesn't happen at all in a half second. And in this half second of the whiplash injury, ligaments can tear, muscles sprain, strain, damage. You have facet syndrome, and the brain itself can actually slap into the side of the skull and cause brain damage, which can result in headaches, memory loss, personality changes. And the thing that really irritates me about this subject is many patients have these issues even when they're in youth, but don't realize that they have problems until 3 to 5 years later. And then they're coming into my office and they're paying out of pocket would have been completely free and covered by their insurance carrier if they had been checked. But many times they go to emergency room, they take muscle relaxers, which is fine. Go ahead and get checked out. It's a good thing to do. But they don't really address the problem. They downplay it and minimize it, and they don't get the care they need. So today we're going to be talking about the 4 phases of whiplash injury and what happens. It is pretty violent. It all happens in about a half second. Phase 1, the car is struck and begins to move underneath you. Your mid-back is flattened into the seat. Your body lifts upward towards the roof of the car, and the neck and the low back flatten and the disc compress. The head violently moves forward. The neck restraint will protect you some, reducing injury by 11 to 20% if it's adjusted properly. But most of the injury will occur before your head hits the seat. The axial compressive force of the spine is in the range of 33 pounds. So that's a lot of weight on the spine. It compresses the disc, and it changes how the spine behaves, because when the discs are compressed, then funny things start to happen in the spine, and it sets you up for phase 2. In phase 2, both the head and the shoulders are at the peak acceleration while the vehicle is slowing down. The head and shoulders are moving forward, and the torso is forced into the seat. The feet press back down onto the brake, which makes deceleration more violent. And excuse me, I skipped ahead. This is in phase 3, but in phase 2, your head reaches full acceleration, and the body's moving forward, the head's moving back. And this is what I talked about from phase 1. It's basically developing an S-curve or a shearing in the spine. It's a very dangerous situation, as I said, that can result in disc, ligament, muscle, and facet damage. The facet damage often is difficult to see on imaging, and many patients, you won't see this on MRI and X-ray sometimes, and facet injuries where they line up like this, they buckle back over, they stretch, and they change the way the joint moves, and this pain can result in years later. More often it's like this dermatome type pain that you'll get across the shoulders and a facet damage. That leads us to phase 3. In phase 3, both the head and the shoulders, like I said, are at the peak acceleration while the vehicle is slowing down. So the vehicle's slowing down, and now the head's starting to move forward, and now you're starting to be tucked in from the seat belt, and people are going to start having, as we move into phase 4, the final phase, the most destructive phase, you're going to start having compressive forces against the sternum. This can injure the ribs, the sternum. You can end up with a syndrome where you have scar tissue across the ribs, and this can cause pain that comes and goes. So it's a pretty serious situation. So in phase 3, the shoulder restraint protects you from being ejected from the vehicle, and that's a good thing, but it sets you up for phase 4. Like I said, this is the most damaging phase. The seat belt causes a violent flexion of the neck, and the muscles and ligaments are strained, and the fibers of the disc can tear at this point. The vertebrae can also misalign at this phase. As your head drifts forward, the brain can actually smack into the side of the skull. This can cause lesions internal bleeding, and like I said, memory loss, personality changes, headaches. So a very serious situation. If you're not restrained properly, obviously you can hit the windshield or the steering wheel, and that can have further damage. So it's just not a good thing all the way around. So what does this actually do to help you, this information? Well, unfortunately, there's not. I just want to fill you in so you can know it is a serious thing. Please don't minimize it. But more importantly, get checked out, because this is your one time to get checked, get it handled properly. If you're not checked within the first 6 to 8 weeks after this type of accident, it's a lot harder to treat later on. I guess the best thing you can do is what I talked about in other articles, is basically get ready for it. Press down, get ready. Just like if someone's going to punch you in the stomach, it'd be a better scenario than if you're all loosey-goosey and just getting hit. So bear down into the seat, push your feet down the brake, tense up your neck, get ready for it. And after a situation like this, go to the hospital, get checked out, go to your local healthcare provider, use ice, ice, ice for the first 48 to 72 hours. And what we're going to be doing in the next couple weeks is talking about the warning signs, how to listen to them, what to talk to about your provider, some other great stuff. But that wraps it up for this week's Way to Wellness, the 4 phases of a whiplash injury. You'll know what to look for and be ready to be able to tell your healthcare provider different symptoms so they can give you the best course of treatment. I hope you're starting off the new year great, and look forward to talking to you more in the coming weeks and throughout 2010. Also, a little FYI, new venture here, the Virginia Mobile Therapy. We're now open in Caroline County, Spotsylvania County, Fredericksburg, King George, Callio. And so if you or your family or friends have anyone that's hurt, definitely refer them out to one of those offices. We'll get them checked out. Care to all our automobile accident patients is at no out-of-pocket cost to them, and they can get checked, and we can find out what's going on with them. Till next time, stay on the way to wellness. Thank you.